Hi, everybody, and welcome. We are so glad you're joining us for today's webinar on eviction prevention, strategies for supporting individuals with serious mental illness and substance use disorders. My name is Jen Elder, and I'm the director of the SAMHSA Homeless and Housing Resource Center. So I'm going to start with just a couple of housekeeping slides, introduce our new toolkit, and then we will dive straight into the content. So next slide. First, I'll start with a quick disclaimer. The Homeless and Housing Resource Center is funded by the Substance Abuse and Mental Health Services Administration, or SAMHSA, but the views and opinions expressed today are those of our own and don't necessarily reflect those of SAMHSA or HHS. Next slide. So we are joined by 2 American Sign Language interpreters and a live human captioner today. So we appreciate them taking the time to be with us today. If you have any technical difficulties, you can email us, but also a quick way to get to us is just to send a note through the Q&A. So with that, a couple other housekeeping notes. We do have everybody's mics are automatically muted today, and the chat is disabled. We have a large number of people joining us. But that said, we want to hear from you. So if you find the Q&A button at the bottom of your screen, that's where you can submit questions. If you just have feedback for the presenters where you're like, that is right on, that resonates with me, send that to us through the Q&A, and we will make sure that we get that to all of the panelists today. So reach out to us. At the end of today's session, there'll be a really short evaluation. After completing that, you'll be redirected to a certificate of participation. Now, we don't have CEUs included in that, but sometimes you can take those certificates to your licensing board and use that, or just have it in your own portfolio for training. All right, next slide. So those are my housekeeping, and now I'm excited to introduce to everybody our new HHRC Eviction Prevention Toolkit. Now, this toolkit covers a range of topics about eviction and behavioral health, key competencies, innovative eviction prevention strategies, legal resources, and non-legal needs and resources. So it covers a pretty wide gamut. I'm going to say I'm excited that some of the toolkit authors are the panelists today. So you're going to get to hear straight from the experts today. It's available now. We'll put a link in the chat, and it's available both in English and in Spanish. So next slide. So just to frame the discussion briefly before we get started, eviction prevention is a really wide topic. We know that we're having this webinar and toolkit because we have heard from you in the field. This is a need, and it's a very multifaceted need. So I just want to set the stage that what we're going to be able to cover today is really how eviction prevention intersects with, for people experiencing serious mental illness, substance use disorders, or co-occurring disorders. But at the end of today's webinar, we have links to a lot of other resources from HUD, from our national partners, because we also know this is not going to cover everything you might possibly need to know about eviction prevention, but it's a great place to start. So with that, we'll have a panel presentation, time at the end for discussion and questions. A big thanks to those who submitted questions during registration. I think we received thousands of questions. So again, to say, lots of resources out there. We will keep trying to, help meet your needs, answer questions, but really just want you to sit back and enjoy today's webinar. So with that, I'm going to hand it over to Rachel Post, who is going to kick us off and get us started. Thanks, Rachel.
Thank you so much, Jen. And good afternoon and good morning, everyone. Thank you for joining us. We are so thrilled to have so much interest in this topic. And today, as Jen said, we'll be doing kind of a high-level overview of the toolkit. Of course, we can't do it justice in 1.5 hours, and so we really hope that you will download that. There are so many links to additional resources in the toolkit that we think you'll find useful. We certainly found them useful. And so I also want to just recognize today we have, in addition to myself, we have 3 of the other co-authors. So we have Juanita Spotted Elk, who is with the Washington State Lived Experience Coalition. We have Ayana Gonzalez and Matt Leslie with TAC, the Technical Assistance Collaborative, which is also where I work. And then I also just wanted to recognize that we also had some additional authors. So we had Arvind Sukhnan with the Technical Assistance Collaborative, Natalie Goodman also with TAC. And then in addition to Juanita Spotted Elk, who will be speaking with us to kind of start us off and laying the sort of central theme about why eviction prevention is so important, we also had Sarah Holscotter. And so I just wanted to really recognize and appreciate all of the people who contribute to this toolkit. I want to also just acknowledge that we had many key informants who we interviewed to help us think through how we wanted to develop the toolkit. And we so appreciate every one of those people who is named in the actual toolkit. Juanita was so helpful in us conceptualizing how we wanted to lay this out, that we also asked her, as well as Sarah, to be reviewers of the toolkit and to offer really significant, important edits through their lived expertise in working with people who are experiencing behavioral health conditions and who are being placed into housing from homelessness. So with that, I would like to just welcome and appreciate Juanita Spotted Elk, who's going to kick us off. And Juanita, you are on mute, and you may be having some technical difficulties. So I'll just ask again if you are able to come on camera and unmute. While we're waiting for Juanita to do that, I'll go ahead and at Juanita's request, she asked if we could play this Coast Salish anthem as sort of a reference point, or doing it for the culture, what we often call do it for the culture. And so she asked if we could open with this. So I'm going to play a minute of this, and hopefully we can get Juanita back on camera. That was beautiful. Juanita, are you able to join us now? All right, Juanita must be having some technical difficulties, so we'll see if we can get those addressed behind the scenes. But while we're doing that, one of the things that Juanita wanted to kind of set the tone for is talking about the impact of evictions on people's behavioral health, right? Whether you're a person who has experienced homelessness in the past, or you are being faced with your first ever eviction, it is really a traumatic and catastrophic event. It's not something that is just sort of like an everyday event, right? And we really need to be attending to the population of people we're working with recognition of that eviction is traumatic. It's happened to many of the people who we are serving through supportive housing, and it will happen again. And we also really want to recognize that eviction complicates people's eligibility. Sorry about that. Eligibility to access housing and exit homelessness. Eviction can be harmful to people's physical and behavioral health, right? If we don't have a safe place to stay with a roof over our heads, it's really hard if we have a chronic health condition to be able to take care of ourselves and rest. And we really need to be attending to the population of people we're working with recognition of that eviction is traumatic. It's happened to many of the people. Jen and Alicia, it seems like we've got some eligibility to access housing and exit homelessness.
Hi, sorry about that. I see that Juanita was having some technical difficulties. Looks like is logged in now, so might just like pause and have her come back on camera and see, and we'll all go on mute and see if that helps the echoing that I know that I was hearing.
Okay, Jen, maybe I'll just pick up and you all can hear me in real time and everybody can mute. Great, thanks so much. Apologies, everyone. We also just want to recognize that eviction can impair people's opportunities for recovery. So with that, I think we will go on to our next slide. So what is eviction prevention? Eviction is the court-ordered removal of a tenant from property where they reside. And eviction prevention is sometimes framed only as activities that impact the outcome of a legal eviction process. This toolkit, however, imagines eviction prevention more broadly. We use the phrase eviction prevention to describe any activity that helps someone maintain their tenancy in the face of circumstances that might otherwise jeopardize their housing. And so throughout this webinar, we will be talking about each of the sections in the eviction prevention toolkit that really look at that more broadly. And these bulleted areas are what we will be addressing throughout. So I'll move on and want to talk about that we really also must recognize that every single person who interfaces with people who are placed in housing, who are assisted to access supportive housing or affordable housing, whether you're a housing navigator, whether you're a case manager, whether you're a program manager, whether you're a landlord, that these are key competencies that are necessary to be able to possess. And you'll see in the toolkit that we talk about each of these. We talk about trauma-informed response. We talk about housing first. We talk about centering equity, a focus on recovery. And when I say recovery, I don't simply just mean abstinence, right? Recovery can mean anything to any individual that helps them to optimize their human potential. So recovery from mental health symptoms, from the experience of being a psychiatric survivor as a result of community mental health or psychiatric hospitalization. It can mean recovery from substance use. It can mean a variety of things. We really need to attend also to harm reduction. And here, when we talk about harm reduction, you'll see in the toolkit a full explanation of all the phases of harm reduction. It's not simply just putting someone in housing and offering them Narcan, right? It's also assisting people to continuously engage in identifying what they want for themselves, how we can help people who are not interested or ready in engaging in alcohol and drug treatment to use in ways that are less risky, and continuously having the conversation about what people want for themselves in their life. And then, of course, really being focused on person-centered services and ensuring that we are co-creators, that we are taking our cues as case managers, as housing navigators, as behavioral health providers from an individual and what they say they want, and that we are supporting the development of a service plan that is consistent with that. So we'll get into a lot of this in more depth. So now I'd like to go ahead and pass this over to my colleague, Ayana.
So the next section is on effective and innovative eviction prevention strategies. And I think, Rachel, actually, we're going to kick this off with your case study, right?
That is right. Thank you, Ayana. I was jumping ahead of the game here. So we wanted to kind of help exemplify those key competency areas through sharing a case study. The name, the gender, the age, all of that has been changed to make this sort of an anonymous case study. But we wanted to share this with you and kind of frame, as you look through the eviction prevention toolkit, how you would serve this individual. How do you support this particular individual? So Ken is a 43-year-old man with a gentle and warm demeanor who has a strong relationship with his psychiatric prescriber, who he knows as Sherry, and also a physician with the Healthcare for Homeless clinic. He has been living with unsheltered off and on for 20 years and has a diagnosis of schizophrenia. He is also an injection drug user and has been diagnosed with HIV/AIDS. Ken is well known by the street outreach team, who have built a strong rapport with him. He has many friends on the street, and upon exploration of his desires to be housed, he's open to accepting supportive housing placement if he can continue to see his outreach workers, his friends, and Sherry. So let me share a little bit more about Ken. So while working to place Ken, the outreach workers worked in coordination with his psychiatric prescriber, that's Sherry, and refer him to a supportive housing team. The team is oriented to Ken's history on the streets, his diagnoses, stated preferences, and the ways in which rapport has been built over time. All of this is very important for the supportive housing team to understand how to develop a relationship with Ken. The outreach worker and one of the supportive housing case managers meet Ken a few times where he is staying in a small encampment to begin rapport building with the case manager. Through conversation, Ken, the outreach worker, and case manager share a typical lease agreement so that Ken understands both his rights and responsibilities once he's placed. They also discuss some of the situations that can interfere with maintaining a housing placement. So for example, in my work, working in programs in both Portland and Denver, I've had scenarios where an individual we placed may continue to want to see their friends who are still living on the streets. And in fact, they may even feel kind of guilty about being housed while their friends are still out there. And so they may invite their friends to come and stay with them. So talking with Ken about that kind of scenario in advance helps the team and Ken to be prepared for how to respond in that scenario. Ken agrees he can follow the lease agreement and is placed in a scattered site mixed-use building in a studio apartment. His street outreach worker friend, and it's important that he's identified this person as a friend, that's how known he feels and understood, and his new supportive housing case manager help him with move-in. They're present when he signs the lease, And they offer the landlord a number they can call 24 hours a day, 7 days a week in the event of an emergency or some kind of a crisis where they need support. The case manager and Ken locate the various furnishings from a community warehouse and food from the local food pantry. This is important. We don't want to just simply give someone a key and they have no furnishings, they have no food, because we want to make this feel like a home, right? The case manager and Ken develop a preliminary service plan to identify Ken's goals and necessary steps to maintain his studio. For example, like cleaning your apartment on a weekly basis, how to use a stove safely so that you're not storing your newspapers in the stove, or you're not putting some kind of plastic dishes on top of the stove and then we turn it on and oh no, look what happens. Practicing skills for following guest guidelines, those kinds of things. When asked about Ken's interest, he shares he used to fool around with old cars and always wanted to be a mechanic. So they will explore employment opportunities in community college classes that could help him work towards his dream. He also agrees that for the first week, his case manager will check in on him daily to see how things are going and check in with him at his apartment. He shares the best time to visit him is around noon because he likes to sleep in. And Ken still spends time out on the streets with his friends, but for the first month, he's doing really well. He's maintaining his apartment and working with an area support employment specialist to see if he can find a job working in like a garage. So at this point, a month in, his case manager is visiting him 3 times a week at his apartment. Ken's still active in his substance use. And while he's still active, they have discussed whether or not he would like to engage in substance use treatment. And he says someday, but that he's not yet ready. So the supportive housing program connects Ken with one of their peer recovery coaches, someone with lived expertise in substance use who's now in recovery, who's also visiting Ken once a week to begin exploring through motivational interviewing Ken's interest in abstinence. The supportive housing team has helped Ken access both Narcan and a clean use kit to protect him from overdose, from other exposure to other blood-borne pathogens, and to encourage him to protect others from HIV/AIDS. They've also supplied Ken with his primary case manager's cell phone and an after-hours phone number he can use for crises. After 3 months, Ken's friends begin showing up at his studio, and because he feels guilty about them not having their own place, as we predicted, and because he is a good friend, he lets them in. They're staying overnight, and their presence begins to disrupt Ken's neighbors who complain to the landlord. So we're going to leave off with Ken's case study there. Ayana, who will share the next few slides, and Matt later will pick up Ken's story and talk about what we're going to do.
Thanks, Rachel. I appreciate it. Okay, so in the next couple slides, the next part of this webinar, we're going to start to really dig into some concrete strategies to prevent eviction among folks with behavioral health conditions. And as Rachel said, as you listen, right, you can try to think about how these strategies might work or might not work for Ken and for other folks that you know and that you work with and that you care about. So one of the very best ways to prevent eviction is by identifying those who are most likely to be at risk of eviction. And then once they're identified, responding to any potential challenges that they have or may have long before their tenancy destabilizes. And that sounds great, right? But it's sometimes easier said than done, because how do we identify who's at greatest risk of eviction? And the truth is that we can never really know 100% how anyone will fare in housing over time. But we can use research and data to tell us who is most likely to be served with an eviction notice based on some household and some demographic characteristics. And so what the research tells us is that people with behavioral health conditions are at an increased risk of housing instability and exposure to potential eviction. The research tells us that low-income renters are at greater eviction risk than their higher-income peers. And it tells us that Black households are 4 times as likely to be evicted as white households, and that Black families with minor children are at even greater risk. Next slide, please. So we know who's most likely to become evicted. We know that it's poor Black and brown people with substance use and mental health conditions, and especially those that have children in the home. So then what do we do with this information? The next step is engagement. So we have to engage these folks that we've identified as most at risk in proven interventions before their tenancies become jeopardized. And there are a number of interventions that have been shown to help households maintain their housing stability and prevent eviction filings. So the first one of these interventions is the provision of high-quality, multidisciplinary, housing-focused supportive services. I'm going to say it again. High-quality, multidisciplinary, housing-focused services. And I said it twice because it's that important, and you'll hear a lot more about what that kind of service looks like in a minute when Rachel comes back. The second upstream proactive intervention for eviction prevention is the provision of long-term rental assistance, like the Housing Choice Voucher Program, which we sometimes call Section 8, or the Section 811 Project Rental Assistance Program. But really, I'm talking about any non-time limited housing assistance program that limits a tenant's rent to 30% of their income. Because unsurprisingly, ensuring that a household can afford to pay their rent helps prevent eviction. Another important eviction intervention is the provision of one-time or short-term financial assistance that can cover rent or utility arrears or back payments. And it can cover short-term rental assistance to help tenants stabilize their at-risk tenancy when things go wrong, when they're having a difficult time, and just get back on track before they fall too far behind. Finally, culturally responsive supportive housing services that consider the specific needs of Black people, Indigenous people, and other people of color, and that consider the needs of households with minor children are of particular importance for these populations. So a one-size-fits-all approach is not going to be effective for everyone. It's not going to be effective for most people. And that means hiring staff who look and live like the people that we serve. It means meeting folks in their own communities and in their own languages and observing their cultural practices and their traditions. And then, so having said all that, I'm going to pass the mic back to Rachel, who's going to talk to you about those services that I mentioned at the top of the slide.
Thank you, Ayana. So we really can't overstate the importance, as Ayana said, of high quality and multidisciplinary supportive housing services. And while not every supportive housing operator is currently funded in a way that will allow for this, it's really important to work with all of your COC partners to work with your community behavioral health agencies, your community health clinics, all of the different partner systems, which we'll be outlining actually in a soon to be released another HHRC issue brief on how to build those partnerships, but really to make sure that you are partnering with all the systems that do offer those level of services. One example of a highly comprehensive supportive housing service model that not everyone will qualify for, but it is the model that the original Housing First program was designed after, and it's called the assertive community treatment model. And this is a model where a team of multidisciplinary staff, so staff who have mental health expertise, staff with lived expertise of homelessness, of perhaps histories of incarceration, alcohol and drug use, staff who are certified alcohol and drug treatment specialists, nurse practitioners who can be prescribers, all of these disciplines, employment orientation, working together at a ratio of 1 to 10. So for every 10 program participants, there's 1 staff. The Model Act was designed back in the 1970s when there was effort to deinstitutionalize people from state psychiatric hospitals. And they found that by offering this comprehensive community-based treatment team, that they could really support people in living successfully in the community. They could reduce use of emergency room visits. They could offer 24/7 crisis response capability, and again, be delivering those services in the community. So we don't want to set an expectation that people should be, say, coming to my office once a week at this particular half hour if they are a person who is living in supportive housing, right? We need to be in the community. So that's one model. We also really need to incorporate efforts to support people in feeling a part of community to prevent social isolation. And so that can look like a number of different types of programs. The toolkit, we describe some of the various types of options. Our colleague Arvind Suknan spoke about his experience with Fountain House, which is a clubhouse model and is a community that is working to support people with diagnoses of mental illnesses to be in community together, to be engaged in community activity, to support people towards securing employment. And so moving down to supported employment, really important to be thinking about. Again, our goal here is not simply to just put somebody in housing, but it's also to help people have a meaningful life. And going back to the roots of what a person always wanted to be and supporting them in attaining some of the goals that, that they're interested in. And then ongoing tenancy education, right? It's not a one and done. It's not like, okay, here's your lease. Do you understand it? Okay, great. See ya, right? We need to be checking in with people regularly, be connecting, which Ayana will talk about a little bit, with their landlords, to be checking in on the conditions in which they're living within their unit, if they're having any problems with their landlord or their neighbors, right? That's something we need to be working on consistently. Ayana, back to you.
Thanks. Okay, so partnering with landlords. Landlord engagement is a really, really powerful tool in helping households avoid eviction and maintain stable housing. Folks that know me know that I like to say the landlord should be a supportive housing provider's second client, right? Because landlord relationships require a lot of the same key components that successful client relationships do. And you can see those components up on the slide. So the first one is engagement. You want to engage potential landlords through outreach to industry stakeholders and to individual property owners. And you got to listen to landlord concerns and assess what their needs are. Target your landlord supports to each individual property owner's priorities and provide incentives and assurances to address their needs and to recruit additional partners. Next is trust building. So building trust always starts with transparent communication. So with landlords, this means you're going to need to provide them with assurances. And they might be anxious, right? They might be anxious about renting to households that have experienced homelessness. They might be anxious about renting to households with people who have behavioral health histories. So describe your population, you know, explain your programs and your services. and then actually provide those services that you've explained. The best landlord supports are always going to be good tenancy supports. And that means following through on your promises and your commitments around the services that you describe. Responsiveness. So you want to ensure that landlord calls receive a rapid response. This looks like creating policies for maximum response times and determining how landlord calls will be covered when the designated staff contact is not at work, right? So what happens on holidays, what happens on nights and on weekends? Because these are often the times, if we're being honest, when crises occur. And then finally, regular check-ins, right? Just like you would with anyone else that you're in a relationship with, you want to check on them regularly. This can look like sending thank you notes to landlords after they house a participant. You can schedule a monthly or quarterly check-in call with each household's landlord just to see how they're doing and make sure that, you know, you're aware of how things are going before problems arise. You could host an annual appreciation event for landlords who stick with the program. But you just generally want to make landlords a part of your caseload, a part of your everyday work, and a part of your community. Next slide, please. Okay, mitigating non-payment of rent. So even the best landlord relationship in the world will begin to deteriorate if the rent isn't getting paid. So this is an important issue. Non-payment of rent is a really common reason for eviction filings. So tenants who struggle to pay their rent on time and in full can really benefit from targeted support to assist them in making or catching up with their rent payments. And this kind of support is an essential way to stabilize and preserve at-risk tenancy. So this kind of support or assistance can include help with budgeting and help managing and balancing income and expenses to prevent any arrearages from occurring, arrearages like late payments. It can look like working with the tenant and the landlord to negotiate and establish a repayment agreement after an arrearage has occurred. So you can do that work to prevent people from getting behind, and then you can do that work to sort of work it out with the landlord after someone's gotten behind. And hopefully your landlords will be more open to these conversations because of the front end work that you've done with them to build relationship and build trust and, you know, have those regular check-ins. Then there's landlord mitigation funds, right? This is a pot of money that can be used to provide the landlord with access to flexible financial assistance to cover those rental arrears when they happen, to cover utility arrears if they happen, to cover short-term rental costs when maybe a tenant has something going on and they can't pay the rent, or to get them caught up if they've gotten behind. These monies can be used to pay for damages. They can be used to pay for legal fees if the tenant's not able to pay them on their own. Just anything that you might need to make a landlord whole when there's money to be paid and to preserve an at-risk tenancy. Another thing that providers can do is to offer representative payee services. This is when an external party, that could be the provider or someone else, is designated to manage a tenant's income for them to ensure that their rent and utilities are always paid on time and they don't get in a situation where there's a non-payment of rent issue happening. And then finally, moving on strategies. So these are critical in helping tenants whose rental assistance resources are time limited move into permanently affordable housing before the time limit ends in their short-term assistance. So this helps ensure that tenants that are in rapid rehousing or other short or medium-term rental assistance programs have the support and the guidance and the resources they need to transfer into a long-term subsidy. And it prevents them from struggling to pay their rent or maybe falling behind and risking eviction when their time-limited assistance ends. Next slide, and Rachel, I think that's you.
Thanks, Diana. So people with behavioral health conditions may experience symptoms that interfere with their ability to always fulfill their responsibilities in their lease agreements, right? And this is why we offer supportive services for that very reason. With this fact in mind, case managers, peer support providers, housing navigators must be continuously on alert for potential violations specific to maintaining the tenant's unit and being a good neighbor. And supports in addressing these arising circumstances can include, so mediation between tenant and landlord or neighbors are the easiest because they just involve a conversation. Work with the tenant, with the landlord, and with neighbors if needed to identify the behaviors that have been problematic for them. And update service plans if needed to assist in supporting people to either modify their own behavior or sometimes, as I was reminded by our colleague Sarah, who contributed to this, sometimes landlords can exhibit problematic behaviors. Assess the program participants' receptivity to accessing behavioral health services or harm reduction strategies if they're under-engaged in those services or unengaged. And also invite their behavioral health or treatment provider into the conversation about what's going on with them that is compromising their housing stability and that may lead to an eviction. Assess tenants' willingness to receive services that may treat their symptoms and behaviors that are putting tenancy at risk. Sometimes people may not be receptive upon move-in, but if they see that potentially some of the symptoms may be compromising their ability to follow their lease agreement, people might be more willing to accept those services. And then also facilitate, if needed, an amicable move before legal action is initiated. Sometimes, despite everyone's best efforts, a housing situation just isn't a good fit. And if the landlord, tenant, and service provider agree that a particular housing environment is unsuitable for the tenant, then maybe the tenant and landlord can come to a mutually agreed upon termination of the lease without legal eviction or lease breaking violation. Again, we'd love for you all to look at the toolkit more in depth because there's a lot more discussion of that in the actual toolkit. And with that, I'm going to pass this over to our colleague, Matt.
Thanks, Rachel. The final section will be a high-level overview of the legal aspects of evictions and supports that can help prevent or minimize the impact of tenants at risk of eviction. We will end by checking back in with Ken's situation as well. Despite all best efforts at upstream eviction prevention, including the provision of long-term rental assistance, high-quality targeted supportive services, comprehensive landlord engagement, and flexible crisis intervention and support, some low-income tenants with behavioral health conditions will still be threatened with or receive an eviction notice. If this happens, it is important to ensure that the tenant has access to legal services, accurate information, and support to help them through the process. Next slide. State and local laws, local court regulations, and the language in each specific lease determine the rules of evictions. Tenants and advocates must read leases carefully and understand the laws governing their local jurisdictions. Nevertheless, the process has some common features that are usually applicable to most people and situations. Typically, landlords must give tenants a notice to quit before they may be evicted. The notice should explain why the landlord wants to evict, how to prevent the eviction, example, by paying outstanding rent balances, and the date by which the tenant must respond before the landlord takes additional action. In most places, landlords must wait for a set period after issuing a notice to quit before moving forward with the next steps for an eviction. This gives tenants and those who support them time to address the issues identified in the notice, work collaboratively with the landlord on a solution, or agree to leave voluntarily. Laws vary by state, and service providers must be familiar with the process in their state and how to find case information online or by phone. If the tenant does not resolve the issue or move out by the specified date in the notice, the landlord may file an unlawful detainer, or otherwise known as a UD, with the appropriate court. The landlord will need to serve the tenant with a copy of the summons and complaint. The court will schedule a hearing where both the landlord and tenant can present their cases. Some cities or states have specialized housing courts focused only on housing-related cases and disputes between tenants and landlords. Other communities rely on their regular civil court system to respond to eviction filings. During the court hearing, the court will schedule a hearing where both the landlord and tenant can present their cases. The judge will then decide whether the eviction is justified based on the evidence presented. If the judge rules in favor of the landlord, they will issue a court order for the tenant to vacate the premises by a certain date. Engaging with the landlord and/or legal support as early as possible is really vital to ensure tenants are well prepared for the hearing. In most states, once a judge has ruled in favor of eviction, the tenant must move out of their apartment by the day the judge is determined. If the tenant is still in the unit on the formal eviction date, a local law enforcement officer may come to the apartment to remove them, their family, and their belongings. Next slide. Landlord-tenant laws are established to protect both tenants and landlords' legal rights. They outline both parties' rights and responsibilities and can really help resolve disputes. These laws cover many of the landlord-tenant relationship aspects, everything from security deposits to landlord access to a rental property. Tenants and landlords who understand and act upon their rights and responsibilities are less likely to use the courts to resolve their disputes. These laws vary significantly by location, which prompted Congress to direct the Legal Services Corporation, LCS, to perform a study to better understand the differences in laws and procedures across the country. The Eviction Laws Database, which is in the toolkit, is a comprehensive online tool that allows users to explore their community's legal eviction process. Next slide. And just a reminder, as I said previously, eviction laws vary significantly by location, so it's really important to become familiar with the specific laws in your own jurisdiction. Providing low-income tenants with free or low-cost legal representation is a proven way to reduce evictions nationwide. And tenants with legal representation win or settle their cases favorably 96% of the time. Support can be consultation to better understand landlord-tenant laws and tenant rights, or can be legal representation in court through legal aid or other pro bono legal support. Next slide. There have been some promising practices in recent years on eviction diversion, particularly through the federal government's COVID response emergency rent assistance program. As mentioned earlier, no cost legal assistance to low-income tenants at risk of or subject to eviction can be an effective tool in mitigating the traumatic impact of evictions. There's been a growing number of court navigation programs that help guide and inform tenants of their rights and protections when going through the eviction process. The eviction process can be really scary. It's a, definitely a traumatic experience. Service providers can create court-based eviction diversion programs with legal and holistic support services, including providing financial assistance that potentially could assist in a payment plan or pay rent debt, or rent arrears, providing free or low-cost legal advice or information. They also do on-site pre-screening for local rental assistance programs that may help reduce the amount of the rent moving forward and make it more sustainable. They provide assistance with application for other public benefits, and also can provide mediation services for tenants and landlords. Next slide. If the tenant has a court hearing, it's really essential that they appear in court. If the tenant does not appear in court, the landlord would automatically be granted possession of their residence. 5 in 10 tenants do not appear for eviction cases, and there's many reasons why they're not appearing. Confusion about when and where to appear, what is required and who makes those decisions, childcare, not having childcare, having a disability, having transportation, getting time off for work or school, the distance to travel, and also just a general intimidation of the power dynamics of courts. So supporting tenants through this process is really, really essential. Next slide. We are now going to discuss what is described as what we call slowing down the process and give an update on Ken from our case study. A recent study on homelessness in California, a state with some of the strongest rent protections, found that for those that entered homelessness from being a leaseholder, they had a median warning of 10 days before leaving their housing. This is more likely a result of tenants not understanding their rights and protections and what we call self-evicting, and therefore not going through the formal process that could really buy them essential time to either remedy the situation or more time to find another housing solution. Supporting individuals with the process can really be an effective way to minimize the impact of evictions. We are seeing more and more programs out there that are really helping to provide that support. I mentioned earlier some of the court navigation resources such as legal aid and education and court navigation can really slow down the eviction process. They give more time to access available community resources. They increase the likelihood the landlord may receive past due rent or at least come up with a payment plan. They create opportunities to reach an agreement prior to a formal eviction, and they provide more time to find other housing if an eviction cannot be prevented. Now we're going to provide an update on Ken's story. Ken's friends kept on staying, and the landlord decided to move to a formal eviction filing. It was imperative to move quickly to mitigate the impact of the eviction for Ken and to find another potential unit that could meet Ken's needs. The case manager continued to communicate with the landlord even after the eviction was filed to see about coming up with a plan to prevent a formal eviction on Ken's records. They also started looking for temporary housing while trying to determine best steps moving forward with Ken. One option was to find a unit that was not as close to where his friends typically hung out, but Ken was worried about being socially isolated. Another option was finding some permanent supportive housing that had 24/7 staffing, and they could help ensure Ken's friends could visit but not stay overnight. They also discussed trying to find a shared housing situation with one of Ken's closer friends, which would also help make the rent more affordable and give Ken some companionship in his apartment. The landlord agreed not to move forward with the eviction if Ken was moved out by a specific date. Temporary housing was located to continue the search for a more long-term solution for permanent housing. This prevented the eviction to be on Ken's record and no longer was a barrier for future housing opportunities. In addition, the case manager worked with the landlord to help to fill the unit with another tenant. And with that, I'm going to pass it back to Rachel.
Thank you so much, Matt. All right. We're going to pause for a moment to be able to take a look at all the questions that have come in. But I also want to make sure that folks know that there are, again, I know I've shared this before, I'll share it again, so many clickable links in the toolkit that we think that you'll find really useful. Here are some that we have included for this presentation today. So you can see that there's the HUD, Fair Housing Obligations and Evictions resources. And if Alicia's able to, she can put these into the chat, but I know that this webinar is being recorded and the slides will be available and posted on the HHRC website. We have the HUD rent relief resources. We have HUD's COVID-19 homeless system response strategies for eviction prevention from the National Low Income Housing Coalition. There's the state and local innovations toolkit. The U.S. Treasury Department has a document titled Eviction Diversion, and the National League of Cities has also issued an eviction prevention learning lab. So We realize there are so many questions today, really important questions. We're not going to be able to get to all of them, but we do hope that these additional resources from the Homeless and Housing Resource Center also can be useful to you all if you haven't seen it yet. So they've broken out online courses. So serious mental health illness, an introduction to hoarding disorder, supporting people who use methamphetamine, whole person care for opioid use disorders. I know that each of those addresses how to support people who are experiencing these conditions in their housing units. Also written resources that are available through HHRC. There's a fair housing protections for people with serious mental illness, substance use disorders, and co-occurring disorders. There's an effective property management engagement strategy publication, and then archived webinars that they thought would be particularly useful to the audience who has joined today. We have housing supports for older adults experiencing homelessness, outreach and housing support for individuals with psychotic disorders, serious mental illness and homelessness, taking trauma-informed approach with events of escalation, and eviction prevention and housing retention during and after COVID-19. So with that, I'm just going to check to see, I know Juanita was having a lot of technical difficulties, and I had asked if she could come back and join us. I see that she's not yet here. Maybe Alicia, you can alert me if and when she joins, and we'll just start addressing some of the questions that were asked. I know that I looked at a lot of the questions, and there were a number of questions that were specific to landlord mitigation, where those funds can come from, how to set up a landlord mitigation program, who can administer landlord mitigation funds. I entered into the chat that oftentimes I'm aware that cities, counties, or even the state housing agencies will use general funds to set aside for landlord mitigation, but I'd love to ask Ayana and Matt to come off mute and share what you know about landlord mitigation programs.
Yeah, I saw that question come up a couple of times also, Rachel. And I love that because that means people are thinking about how they can bring these things to their own communities. I think you're right. So public funding is one way to do it. So whether that be city, state, or county based, I know that in some states, they're funded by the state housing finance agency. And in some states, they're funded by the behavioral health entity, right? So the state mental health agency or the state substance use agency sometimes funds them. Sometimes they're locally funded by community service boards or things like that. Sometimes they're funded locally by continuums of care. So public funding, but also I think private funding, philanthropic funding. I think if you can get it, it's challenging. And I think it's different in every community, and it's a little bit of a puzzle pulling money together. Sometimes it's not always easy. Harder post-COVID. I think there was more money for this sort of work during our COVID response. But I think, so that's a negative. I think the positive thing is that during our COVID response, we realized that it works. And so I'm hoping that we continue to see more funding for these sorts of activities and resources available. I don't know, Matt, if you have anything to chime in.
No, I think you kind of covered it. Thanks.
I'd also just like to offer that in the role that I served for a large healthcare for homeless affordable housing operator in Portland, we had a staff position titled policy director. And as the policy director, I worked with lots of other supportive housing operators, community mental health agencies, with the temporary aid to needy family, community action agencies. And we worked very closely together to make the case to the Oregon State Legislature for funding for landlord mitigation, and we're very successful. In addition, many of these advocates, as well as a large group of people with lived expertise, people living in affordable housing, were able to work to pass a measure in the Portland metro area to fund more affordable housing development, as well as landlord mitigation. So I know that it can seem really overwhelming, especially if you are a frontline staff person or a program manager, but we also just can't overemphasize the importance of working with all of your partner systems to advocate for additional funds. Another question that we've had that came up quite a bit was related to, well, how do you work with landlords when you don't want to violate HIPAA, right? And, you know, what do you do about protecting, you know, the rights to client confidence around disabling conditions? One thing that we did was we consistently would ask program participants when we enrolled them into the housing that we operated, as well as when we were supporting people to access housing within the general market. If, as their service provider, we would explain to people the benefit of us being able to advocate on their behalf with their landlords, and would ask if they would be willing to sign a release of information that would allow us to be able to not disclose their diagnoses, but to just be able to share that the person was being served by our program, and that we were able to have conversations that helped promote some of that collaboration. But Ayana and Matt, I would love to hear what other innovations have you all used?
I think that's right. I think that releases are probably the most common and one of the more effective ways. There are some folks that don't want to sign releases, right? And we have to respect that. And I think that in that case, you can talk with a landlord and say, hey, I'm working with this person. You really can't say for whom or about what. But I'd really like to help preserve their tenancy, or their things that you'd like them to know that maybe I could help them work on. You know, you can take all the information from the landlord that you want without sharing information about the client. So.
And oftentimes when it can be effective to have a release, we talk a lot about reasonable accommodations, and we think of sometimes reasonable accommodations of getting into housing, but it can also be a strategy in eviction prevention. And we hear stories about, you know, they get their benefits check on the 15th, but their rent's due on the 5th. So they get, because they have a disability, they can, you know, work with the landlord to get a reasonable accommodation to change when the rent is due. If there's like, you know, an issue with their behavior, that maybe, you know, they could come up with accommodation with the landlord that can really help retain their tenancy.
Great, thank you all. And I wish we had the chat feature, so those of you who are joining us, because you all have lots of expertise too, could weigh in if you have ideas about how to do that as well. I think you could answer in the Q&A.
Rachel, I can answer a question if you want.
Yeah.
There was a question, and I think this is a really good thing to clarify. It says, can you talk a bit more about self-evicting while someone has an open case in housing court? And, you know, what we mean by self-evicting, oftentimes in, you know, an individual's, you know, they get that notice and they just think it's inevitable. And so instead of kind of going through the process, they just leave. And, you know, oftentimes they may, you know, and they may leave to go stay with a friend, but all of a sudden their housing is more vulnerable. They have something goes on. they end up getting, no longer be able to stay there and they're stuck living outside or so, we really, in the eviction kind of diversion prevention world, they talk a lot about like this idea of slowing down the process, but going through the process, like realizing that you do have protections. There is, understanding what the lease says, understanding what your state tenant laws are important, and do not always assume that landlords always know the details of those tenant laws. And that's one of those things that, having representation, and that's where we can really help support individuals, because it's scary when you get that notice. And it's a scary situation, but it may not prevent the eviction, but if anything, it helps give more time, and you never know what other resources could be available, and also just give you more time to find another housing solution so you're not falling into homelessness.
Thank you, Matt. I know there have been some questions about the level of supportive services. There was a question about, do we recommend fidelity to specific models? So for example, the permanent supportive housing model, the assertive community treatment model, they're models that have been researched and documented to be effective in supporting people in both remaining as stable as possible in housing, as well as in treatment programming. And they, offer caseload size information. And so, I think that certainly the more individualized and responsive supportive services are, and the more able that they are to be offered in a person's community, and really are centering the person and relationships and rapport and treating people with dignity and respect, I truly do believe the better the outcomes will be. There are elements of these best practices that are really aligned with those values that I just lifted up. That said, a lot of communities, they don't currently have the level of funding needed to be able to offer a one staff person for every 10 individuals who are living in permanent supportive housing. And that's why it's so important to work very closely in collaboration with your community behavioral health agencies, with your healthcare for homeless or community health clinics, with your housing operators and substance use treatment providers, to do as much as you can to weave together a comprehensive and multidisciplinary team, work with your recovery community organizations, and then work with your state. A lot of states do have, I saw a question about Medicaid waivers that cover the cost of some of the tenancy placement and support services. There are a number of states that have added that into their Medicaid waivers. And so those Medicaid funds can be used to help with covering staffing costs. But really, this is very individualized from one state to another. And so it's important, as you look through the toolkit, that you look at what those systems are in your state, in your locale, in your community, and work with all of those partners to the extent that you can to create more intensive community-based support services. Again, another plug for a resource guide that we're putting out, TAC is putting out through the Homeless and Housing Resource Center, I think before the end of September, that will talk a lot more about how to build those relationships with those systems and how to make the case for weaving together, braiding those funding sources together so you can really provide very comprehensive levels of care to those who need it. Let's see, I saw a couple of questions at the beginning that asked, why is it that people of color may have higher rates of eviction or a harder time accessing affordable housing than their white counterparts. I don't know if anyone would like to take that question.
I mean, I can try and you all can chime in. I think we raised it because that's what the data shows, right? And I think there are disparate impacts for Black people and other people of color in this country across the board in a lot of areas, housing being one of them, because of systemic racism that we have in this country, right? And one of the ways that that shows up in housing is in higher eviction rates for people of color and Black people in particular. I hope that answers the question.
Thank you, Ayana. Are there other questions, Matt and Ayana, that you've seen that you think, oh, we really gotta address this one?
I saw one, Matt, that popped up when you were talking, so I can start, but you can chime in if you want. It asked for an example of a reasonable accommodation request that would address a tenant's behavior to avoid eviction or lease violation. I think you gave an example of one around payment or late payment of rent, and this person is asking for an example of a reasonable accommodation that would address a behavior. So I can give one. So for example, if someone is exhibiting loud banging behaviors, which I worked with someone that banged, made a lot of noise on the floor at night, and their reasonable accommodation, but was just to move them to the ground floor, so that banging on the floor wasn't bothering any tenant below them. So the first available unit that opened up on the ground floor, the reasonable accommodation was that was theirs and they could move to it. And the landlord could backfill the higher unit.
Great. And I see, thank you, Jen. You put a question in the chat. So once the eviction process is started in the courts, did we already answer this one? Won't that be on the tenant's record forever, regardless of the judgment? Matt, is that a question you can take?
I am not a legal aid attorney, and I think there is differences in different states on, I know in Virginia, a UD would be on your record, but a notice would not, I believe. But that is also, a lot of these questions that are real specific. Different states have different protections. So I'm not, could not really answer that question.
Great, thank you, Matt. I have a question here that says, with opioid and fentanyl crisis, do you have any recommendations for affordable housing programs to address the use of illegal drugs on site? Can a person be evicted if they are using illegal drugs in permanent supportive housing? And so I believe, yes, if a landlord identifies that a person is using illegal drugs and their housing is funded through HUD or another federal source, that they could be evicted. That said, the Homeless and Housing Resource Center has 2 really exceptional webinars on this topic that we featured in the slide that was just before the Q&A. And so we would really encourage you all to take a look at those resources. One was specific to working with people who use methamphetamines and how to support them in retaining their housing. And I believe the other one was related to substance use, opioid use, and really addressing the whole person. I think additionally, that is a really wonderful example that you asked about for really bringing in harm reduction, to talk with people about where they use, when they use, how much they use, safety around use, safety related to being able to retain their housing and risks associated with using in their housing, as well as also as part of harm reduction, exploring with individuals if they would like to at any time engage in alcohol and drug treatment services, if they would like to consider living in, if they are responsive to engaging in alcohol and drug treatment services, if they would be interested in living in a recovery housing site where people are abstinent and are have a close-knit sense of community related to their recovery identity. So there are lots of resources that are available on HHRC for you all to look at as well. Thank you, Alicia, for putting that into the chat. Staff burnout, I do want to talk about that. How have you addressed rehousing and staff burnout? Also, are there any guides on PSH exits? When to consider an exit instead of rehousing, in particular related to assaults of staff, portfolio managers, or other tenants? So I really appreciate this question as somebody who has personally experienced burnout, having done direct services with 2 of the original Housing First chronic homeless initiatives, one in Denver and one in Portland, can completely relate. Have had lots of colleagues who have burned out, who we haven't provided the supports necessary to address vicarious trauma, which is the trauma that staff experience as a result of working with such a vulnerable population who have a lot of their own trauma experiences. And so I think that it's really imperative that every supportive housing program has some protocols and practices related to self-care, related to debriefing incidents, and not just in a sort of clinical way, but also really allowing staff to have the space to share the emotional impact. And that I think that those are ways, and there are also many other ways in which burnout can be reduced. With regards to not rehousing an individual, we also have had the experience in the program in Denver. And in fact, this was featured in a New Yorker article several years ago called $1 Million Murray, in which one of our tenants, we assisted in placing that person 3 times. Each time had great difficulty keeping friends who were actively using out of properties getting trashed. And so after the 3rd time, had to come to the decision that we weren't going to be able to work with that individual for a while because we needed to know how things would be different. So that's a difficult conversation. It's not something we often talk about in the PSH world, right? But it does happen. And I think that it's important to consult with your team. If someone has assaulted a staff person or a property manager, I think that it's safe to say that as a former clinician and supervisor over Housing First and PSH programming, we believe 100% that people need to be held accountable for assaulting staff people. So, but Ayanna, Matt, anything else you all would like to add to that?
No, I think you covered it, Rachel.
Any other questions you guys have seen that we need to address?
I just wanted to point out a comment that somebody made, and I think this is a really good point for the eviction on history question. You could write a letter of accommodation, or the individual could, regarding the eviction or any other potential landlord concern, when an application is submitted with evidence of why it wouldn't be an issue in the present. And they do that in Texas for Section 811. So we do hear that oftentimes, just because it's on their record doesn't mean the current situation is the same, and you can, write letters of accommodation at times, arguing that.
I think that's a great comment. I think I've also seen some comments in the chat or in the questions, just elevating some other populations that may be at risk, and which are correct. And so veterans may also be at greater risk, and also people who are fleeing intimate partner violence may be at greater risk of eviction. And so it's important to think about those folks as well.
Yeah. And I've seen a lot of comments specific to, you know, the rental assistance that is made available. It isn't always meeting the cost of what landlords are charging. You know, we know that this is a chronic issue with Section 8, with rental assistance that's made available through HUD COC grants. And that's a problem that is much larger than what this eviction prevention toolkit can address. We know that there are federal agencies and policymakers that recognize this and that are working to address these issues. I think it's even been housing affordability has come up in various presidential candidates' platforms to address. So I wish that Ayanna or Matt or myself could say, oh, you know, just use this resource, but you know, there just are not enough affordable housing units, and the amount of rent that is available just isn't always enough to match what landlords and property owners are charging. Let's see, I know we have about 9 more minutes, and we want to give folks time to fill out the evaluation and to get the I think CEU or the certificate of having completed this. Any other pressing questions or themes that we haven't addressed yet? I'm looking through them. I know my colleagues are as well. Such good questions. All right. Well, I think with that, maybe we will turn it back over to you, Jen. And you can close us out. We really appreciate everyone joining today. We hope that you will download that eviction prevention toolkit, that you will share it with your partners, that you will use it for staff training, take full advantage of it. And thank you so much for having us here today.
Thank you on behalf of HHRC. Thank you so much to Rachel, Ayanna, and Matt. And we are sorry that we had technical difficulties, and so Juanita couldn't share her story, but we will find another way to get that out to you, because we really want to highlight her expertise too. With that, also thank you to our interpreters. And to all your questions, we had over 400 in the Q&A, so I know that we haven't answered everybody's, but reach out to us. We will put our the HHRC inbox address in the chat. If you have questions or want to connect with our panelists, feel free to reach out to us. We are continuing to develop new resources based on your feedback. So I appreciate you with this found few minutes, like you said, to go ahead and click on the certificate, or sorry, click on the evaluation. Let us know what resonated with you, what you'd like to see in the future. We do sometimes crash this evaluation website due to the number of people trying to do it all at once. So that's why we will keep this up. So grab it now, keep trying, and reach out to us. But with that, please go read the toolkit, and thank you again to everybody's expertise today and sharing their information about eviction prevention. With that, thank you so much, and we will see you next time.